Now time for medial elbow.
I'm going to show you how to scan the medial elbow. So the patient position is usually side-lying towards me because it's kind of challenging to get that shoulder into a comfortable position. Now the landmark is going to be the medial epicondyle of the humerus, and I want to get that kind of in the center of the ultrasound screen, or center of the probe. So the orientation of the probe is going to be long on the forearm. The movements are going to be some slight micro movements of the probe sliding towards the shoulder or away from the shoulder until I'm sure that I've got a really pointy bit of that medial epicondyle in view. And then again, I can also make some slight fishtailing motions or angulation of the probe to make sure I've got it nice and bright. Now, the area of interest is going to be between the medial epicondyle, and a lot of times you'll actually get the ulna in view. And so we're looking at the tendon just as it attaches onto the bone, but then also looking at the ligament just deep to the tendon. And that's how you scan the medial elbow.
Now the ligament was quite deep. That banded tissue we saw was actually tendon, and we'll draw that now. Okay, bone. This is the humerus. Of course, this is the medial epicondyle of the humerus. Cartilage, well, in this view, we don't actually see any cartilage. You know, there's cartilage, of course, down in here, but we don't see that in this view. Fluid, well, we can't see any fluid because that's going to be deep inside that joint there, but we can't see any here. Ligament, now this is tendon tissue. This is not ligament. The ligament's going to be way deep down in here, like essentially running just here, you know, way down in here, okay? Tendon, so this is actually intramuscular tendinous strip, and you can see it continue and grabbing on right there. Now all this muscle kind of grabs on like so onto this tendon. All right, muscle, well, this is all muscle there, and this is all muscle here. Okay, we're going to clear that away and draw it one more time. So bone, there's no cartilage to be seen, no fluid to be seen, we'll go no ligament to be seen, so now we're going to go for tendon. The tendon grabs on right there, and this happens to be intramuscular tendon. And then this is all muscle here, and that's all muscle there. Okay, now time to move on to a live model.
Going to show you how to scan and inject the medial elbow, or the common flexor tendon. Patient position is supine, and the affected elbow is near to you, with the elbow flexed 90 degrees. For some patients, this may be troublesome for their shoulder, so you might have to do that or pop a pillow underneath. The landmark is going to be the medial epicondyle of the humerus. We're going to place that in the center of the screen now. And the orientation of the probe is long on the forearm, with the distal end of the probe pointing towards the third finger. The movement of the probe is going to be just a little towards the hand, so I can see a nice view of the tendon, the central portion of the tendon there. I'm going to place the yellow arrow where the needle tip should land. The needle entry angle is like so, in plane, landing right where the tip of the yellow arrow is. It's worthwhile noting the ulnar nerve is safely protected behind the medial epicondyle. We can see it in the view just here. And that's how we scan and inject the medial elbow, or the common flexor tendon.
Okay, now time to move on to the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses, and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.